Hey guys, welcome back to Medical Coding with Blue. It is Christmas in July. So this is the video before the final video for Christmas in July. I want to thank you guys for joining me for the entire series. I have created a playlist as well if you haven't had a chance to catch up on all the episodes from Christmas in July. This has been so much fun, and like I said, we are on the episode before the last episode. So today we're going to be talking about cardiology. I should have named it the circulatory system because that's what it falls under the ICD-10 book. However, we know that we do things and we just update it as we go along. Okay, so anyway, if you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, smash that like button, and at the end of this video helps you, I hope that you will share it. So let's get started. Okay, cardiology, or the circulatory system, part of the circulatory system. There's a lot of things that go along with the circulatory system. I'm leaving a link for the American College of Cardiology down in the description box below. This website is extremely helpful when it comes to breaking down the diagnoses in the cardiology section, okay? Anything that you can get your hands on as far as like the organizations that specialize in a particular specialty, this is really going to help you get yourself familiar with those websites, and it can be just a simple Google search. Okay, that's how I find out most of where all of these other specialty websites are that will really help you. Of course, there's always the New England Journal of Medicine. You can look at them as well. They have plenty of articles about different things, everything that you could possibly think of. And they do, when you sign up on the New England Journal of Medicine website, they do have access to free articles if you sign up. So just putting that out there. That is what I recommend. That's what I read to stay on top of different things, because even though I really love orthopedics and podiatry, I try to make sure that I learn everything about every single kind of specialty, because a lot of times different things are going to affect different specialties as well. Obviously, if a patient has a cardiology condition and they are a ortho patient or a podiatry patient, this can become serious. So it's just something to keep in mind. This is not an ad, of course, for the New England Journal of Medicine, but I'm just letting you guys know what I use. Okay, so the diseases of the circulatory system fall from I00 to I99. From nursingtimes.net, I thought this was really good. The heart has a middle muscle layer, the myocardium, made of cardiac muscle cells and an inner lining called the endocardium. The inside of the heart cavity, is divided into 4 chambers, 2 atria, and 2 ventricles, separated by cardiac valves that regulate the passage of blood. Okay, it's very important to understand the structure of the heart because there is so much involved with the heart, okay? But hypertension falls under the circulatory system, okay? And from Optum 360, now, again, this is not an ad, Optum 360. Optum 360, the ICD-10 CM Expert for Physicians, is the book that I use. There are many different publishers for the ICD-10 book. However, this is the one that I use, the one that I trust, the one that I recommend, because not only does it have these wonderful, colorful plates, anatomy plates in the back, platelets, you know where my mind is, right? It's got so many wonderful detailed plates in the back about the different body systems. It also, at the beginning of every chapter, in the tabular section, it does break down different things that you should know, and it also gives you examples, okay? For example, straight from the book, hypertension secondary is due to hypertension secondary means it is due to an underlying condition. 2 codes are required, one to identify the underlying etiology and one from category I-15 to identify the hypertension. For example, renovascular hypertension due to renal artery atherosclerosis. I15.0 is renovascular hypertension, and I70.1 is atherosclerosis of the renal artery. So when you are further understanding the detail and the breakdown of the disease process, this is really going to help you. This is why I'm constantly harping on you guys to read and study. If you are working in a particular specialty like cardiology, you want to make sure that you are reviewing the entire section of the ICD-10 book, okay? Review everything. Look at the notes, look at the tips. Optum 360 is really good for that. I don't know about the other publishers. Maybe there's a better publisher out there. I don't know. But for what I know and what I trust, it's them, okay? So be sure to look at that if you happen to have an Optum 360 ICD-10 book. Do that, okay? It's going to help you to better understand, because trust me, in the beginning when I first started in medical coding, cardiology was my nemesis. This was a nightmare for me. It was not easy for me, this particular specialty, but I faced it head on. That's what you have to do when you are unsure of yourself, especially with coding a particular specialty. You can't run away from it. You literally have to face it head on. And that is my biggest bit of advice for people who are wondering how can they better learn a particular subspecialty. You need to really look at the disease process itself, the organs that it involves, and everything else, okay? Because that is really what is going to give you that confidence once you start learning it. And just take your time to learn it. Rome wasn't built in a day, and you're not going to build your language and your learning of medical terminology and medical coding overnight, okay? So going on, it also describes when it says hypertension transient. Assign, and again, directly from the book, assign code R03.0 elevated blood pressure reading without diagnosis of hypertension unless the patient has an established diagnosis of hypertension. So just because you see the word hypertension, it doesn't necessarily mean that that's what the patient has. And that's what they're saying when you see hypertension transient. That is what you would code unless the patient already has an established diagnosis of hypertension. And I've seen providers do this, okay? So again, paying attention to the details, then you're going to know which one to pick up, okay? So hypertension controlled, this refers to an existing state of hypertension that is under control by therapy, okay? Hypertension uncontrolled may refer to untreated hypertension or hypertension not responding to current therapeutic regimen. Okay, so this is very important, and especially if you are having to use this in combination with chronic kidney disease and diabetes, you really need to make sure that you're paying attention to what they're saying about the hypertension, okay? Because it can change the code, okay? Hypertensive crisis. This is another popular one that I see a lot of. Hypertensive crisis, assign a code from category I16, hypertensive crisis, for documented hypertensive urgency, hypertensive emergency, or unspecified hypertensive crisis. Code also any identified hypertensive disease, I10 to I15, okay? So that was some of the things that I had wrote down, some of my notes. But when you are coding for cardiology, I would really suggest that you review the cardiology anatomy before anything else. This is really going to help you to understand. Know your guidelines when it comes to heart attacks, okay? In STEMI, and the coding of old heart attacks. So you really want to pay attention to those things. Understand like any kind of therapies that they go along with it, from what medications and what procedures that they are taking. So, or procedures that they're performing for that particular condition. Know that tobacco use does affect the heart. If the patient is receiving counseling for that, that needs to make sure that you bring that all in and make sure that the provider understands that that's something that is very important to document, especially if they're taking the time to counsel the patient about it. it does affect the body in many ways, and the heart being one of them, because that's your entire vascular system. Okay, that is what is causing the whole body to move, to live, and it's very important to take care of your heart. There's many different websites out there. Like I said, I will be leaving the link for the American College of Cardiology down in the description box below. Lots of really good resources there. The National Institutes of Health is another really helpful website when it comes to furthering your understanding of any disease process. Okay. Also, the mayoclinic.org is a very good and helpful website for just further study and further knowledge, growing your knowledge, and just taking the time to learn everything that you need to learn when it comes to cardiology. Okay. I learned a lot more about cardiology because I spent a little bit more time with it, especially because in the beginning, like I said, it was, we did heart caths at the second facility that I worked for. And I'll tell you what, that was very intimidating when I first got into it. But I was lucky. I had a good teacher, and she was very, very knowledgeable when it came to heart caths. And so she would always tell me that the first thing that I needed to learn was the anatomy of the heart. And that was really going to help me to better understand how to code out the heart caths. So heart caths is very involved, and all of those procedures, they are very involved, and I think it's just a little bit too much to put on an episode. So that's why I just talk about it. But passing on the advice that I got from her was, you really have to understand the anatomy of the heart. So if cardiology is your thing and you really need to study on it, do that. Okay, lots of different websites out there for anatomy. Okay, basic anatomy if you were looking for that. Like I said, also the nice colorful plates that are in the back of the ICD-10 book from Optum 360 is very helpful. Okay, so I'm going to go ahead and wrap this one up. Tomorrow will be the final episode. And have you entered in my Patreon drawing yet? I will leave the link for my Patreon channel down in the description box below. And the drawing is going to be coming up on July 30th. So at 7:30 p.m. Central Standard Time, I will be live with all of you. It'll be my attempt to do a live anyway. But I'm going to try to get a live in before, so that way I don't mess it up. We'll see. Anyway, I will go ahead and wrap this one up. So if you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.